This is our school motto at Transplant Primary and Infant School. Go forth and be empowered.
And fun.
What do you have in the bag there?
A toothbrush and toothpaste.
Where did you get it?
The dentist office.
Dentist gave it to you? You like it?
We start off with the health fair. We're getting everything set up and going. We have 4 dentists working,
Right.
2 in our mobile unit, my left, and 2 in the building across the way that we have set up as a dental office per se.
What's the atmosphere been like down here today?
It's been rainy,
Raining,
but rain don't stop nothing.
Wow.
Rain don't stop the show.
but still doing what we're doing, right?
Yeah.
Nice. Are you seeing a lot of children here today?
We've seen so far. We've seen probably about 70 already, and we keep moving. We have a lot more to go.
Okay, so I understand it was raining here earlier. How did that affect things?
Yes, the rain kind of held up a lot of the movement of the day, but we've been managing through. You know, we set up tents and we've been working through rain. We've gotten wet, but we keep moving.
Well, thanks for all they do for Jaja Foundation, Andy.
Jaja Foundation all the way.
My name is Priyam. I'm one of the ER doctors. This is Stanley the Manley.
All right, so guys, since the two are here together, let's just ask a quick question. How are things going?
Great.
Yeah, I learned so much about dentistry and all the tools.
Yeah?
I can mix it up.
You're working in dental today?
Both of us, yes.
Okay.
Clean teeth. Pulling teeth.
You see that? I like it. Teamwork made a dream work, right?
Yeah.
Well, thank you guys. Appreciate you, right? We're on lunch break. How are things going with you so far down here today?
Very good. Very
Yeah?
good. Yeah.
So a lot of children?
Yeah, I saw some children, I saw some parents.
Oh, I saw
Mostly
them.
parents.
Oh, okay.
Mostly parents.
Okay.
Yeah, children were great as well.
Well, thanks for being a part of the team and big up Haiti, yeah? Big up the whole of Haiti, yeah?
Yes.
Big up Haiti.
So this is a mobile dental clinic that we rented to help facilitate our dentists
Right.
in getting through more patients quicker and easier.
So it's fully equipped with all the
Fully
different...
equipped with all bells and whistles of a dental office on wheels.
Yeah, so Dr. Michelle, thanks for joining us again.
Thank you for having me again.
All right. What's your experience been like this morning so far?
Oh, it's been great. We've seen a lot of parents, a lot of kids, and they've all been so sweet. Just
Well,
really
thank-
great to talk to people and try and help out where we can.
Okay, well, thank you for coming again, like I said, and we appreciate you, right?
Thank you so much for having me.
You can say like konnichiwa. Hi. It means hi. You wanna say it back to me? Konnichiwa. Konnichiwa. Yeah.
Tell them hi. Tell her about hi in Jamaican.
Hi. She wanted to ask you if you ate frog. Me? Frog? No, I've never eaten frog. Have you? No?
My name is Diane Palmer. I'm a registered nurse from Miami, Florida. I'm originally from St. Thomas, Jamaica.
Okay, and you?
I'm Andrea Medwinter. I'm a nurse practitioner from Miami, Florida. Originally from Kingston, Jamaica.
Right. So this is our first health fair in the series for 2024. We're here at Grand Spend Primary School in Yalis, in the Yalis area, Albion. What has the experience been like so far with you ladies?
For me, it has been interesting, also exciting and productive. The community and the school has been accommodating. The process has been seamless because everyone was professional, polite, and welcoming.
And what about you, Andrew?
I totally agree. The community has actually been amazing. They've been here for us. We've not been in want of anything. It rained this morning, and everybody pitched in to help us out, make sure that everything was seamless. And the children, it's amazing for us to be here to help the children.
I was about to ask you about the little children. How do you find the children?
Oh,
Very
they're so
intelligent.
sweet, very intelligent.
They were actually self-directed, know exactly why they're here
Right.
and exactly what they want to do. And when they, for example, they go into the dentist, they know exactly why they want to go to the dentist and what they want to have done today.
That's good.
Exactly.
That's your experience also?
That's my experience also. I was very pleasantly surprised, but I really appreciated that these children are, they're very intelligent. So we know that what the education they're getting is A1.
Right. So let's talk about the role of the Georgia Foundation in this sort of initiative. What do you think about the role the Georgia Foundation is playing in bringing this sort of thing alive?
Well, this is my first year, and it was introduced to me by actually Andrea. She has always been on the mission, and I understand fully the reason why she made it as a part of her schedule to come. And this, even though it's my first, it definitely not be my last. I like the connecting two worlds. I like the fact that we are able to come and participate and reach with and help the community as much as we can.
And what about you?
Well, Georgia Foundation is a part of my heart now. I've been seeing the impact that it has in our communities, not just in the schools, but also in the community with the health centers. If we're not able to get the people to come to an area, it's good for us to be able to go to them. So having us come into these areas will reach a broader spectrum of the society. I think having them at school, they're all here, the teachers are coordinating their acceptance for us, then it's more people that we are able to see in a shorter amount of time.
And the last question to the both of you, why is it so important to both of you to give back, to volunteer your time? Let's start with you.
I think it is I would want to say it is your civil duty. Someone has given back so that you could accomplish and achieve, either indirectly or directly, so that you were able to achieve and accomplish your goals and dreams and just simple daily tasks. So I think it's now your responsibility because you are able to go ahead and do it.
And what about you?
The satisfaction you get from it, yes, it's giving back is one, but how you give back and how you feel about giving, with knowing that you're not expecting anything in return, it's always so fulfilling. And that is, my ultimate goal is to always be giving back, be a philanthropist, give as much as I can, because at the end of the day, it's the satisfaction that I get from it, knowing that I'm not expecting anything, but I'm able to impart my knowledge and my strength to somebody else who needs that.
Well, thank you both for your service. We greatly appreciate you, okay? Thank you.
It's been great. I've learned a lot from Dr. Jackie. And I'm mainly work in the emergency department, so it's very different.
Right, so you're just filling in as a dental assistant today?
Yes.
Okay, but you're an ER doctor?
Yes.
Okay. Why was it so important to you to be in Jamaica this year with the Georgia Foundation volunteering?
Yeah, I'm very interested in global health, and so learning from Dr. Dixon and seeing what he's doing in terms of growing his organization and making it to what it is today.
Right.
I hope that in the future I can learn from him and see what I can do in global health later on.
And is there a plan for you to go back to your home country, Japan, and do something there?
Yeah, I'm not, well, Japan's very developed.
Right.
Maybe in the countryside, but, maybe in somewhere
Some
in Latin
other country.
America. Yeah, because
Okay.
I speak Spanish. But, yeah, still trying to figure out what I want to do.
All right, well, thanks for being on board this year, okay?
Yeah, thank you so much for
All right, I
having me.
appreciate it, yeah. Good afternoon.
Good afternoon.
So you've been here at the Grand Spend Primary School since morning. It's
Since
now
morning.
1:20. What has the experience been like here so far?
It's been great. The kids are so sweet and have all these questions, but we're tired.
You're
But
tired?
it's been very nice. Everyone's super nice here.
Now that you're halfway through the day at your
Yes.
first health fair with the
Yes.
Jada Foundation,
Yes.
do you have any second thoughts on volunteering?
No, never. I would do it again. I'm coming back every year.
Yeah?
My name is Patrice Gordon-Poiser.
And what's your role here today with the Jada Foundation?
I am helping to coordinate, so I work with the Jamaica liaison to set up and coordinate the mission and the health fairs.
Right, so you came with a team over here today at the Grand Spend Primary School. Give us an update of what has been going on so far.
So far it's been a very good day. Started out raining, but it's been beautiful ever since. We have seen up to 150 patients so far. The team, the medical team, the dental team, they're very excited to be here. The patients, being the people from the community, the students and the staff, they're very appreciative of the service that they've been receiving so far.
Right, so the children, the student body here, how do you find the children?
They're very mannerable. That much I will say. They have a lot of manners. I can tell that
Well groomed?
they're very well groomed. They're polite, and they're just jovial children and very deserving children, I can say.
Right, so you're here from New York, right?
Yes.
Why was it so important for you to come down and volunteer with the Jada Foundation this year?
So I'm originally from Trelawney, from Jacksontown, Trelawney. I've been living in New York just about 22 years.
Right.
I've always been very passionate about healthcare. I work in healthcare, but on the administrative side of healthcare. I know that there's so many deserving people in Jamaica who can benefit from those of us in the diaspora, our expertise, whether it's clinical or otherwise. And so when I learned about Jaja Foundation, this time last year actually, I made a vow that whatever I can do to help, I would do that. And so when I was asked to come for this mission, I gladly
You jumped on board.
I jumped on board happily.
Right, we saw you gave some help at the gala also in New Jersey earlier this year, last year.
Yes,
That was good, you did a good job.
yes, thank you.
All right, so just volunteering in general, why do you think it's important for people to give back where they can?
That's something that I've always valued, giving back, helping others. I grew up in a very charitable family. We didn't have much in terms of money to give to people, but however we could help if it's with dinner or meal. So that's something that was ingrained in me from a very young age, and so volunteering comes so easily for me. I can do it without second thought. And so with a medical mission like this, it was very important for me because of my lifelong desire to help people to be here physically on the ground helping them.
Well, we appreciate you. We want to tell you that we're very grateful to you that you came down. And thank you on behalf of the beautiful people of Jamaica
You're welcome.
for giving back to us, okay?
You're welcome, and I hope to do much more in the future.
Nurse Pearl, what's your role here today?
I have two roles. Right, currently I am working at the discharge station.
Right.
What that means, I'm sitting in a room with all the physicians, and after the persons are seen by the physicians, I actually look at the notes that were written, and based on the diagnosis and any treatment plan, and I begin, I'm sure the doctors did some teaching too, but I make sure before the patients leave here, they understand their treatment plan and understand what to do after we leave here,
Right.
such as follow up with their local physician.
Okay.
I also check to see if the doctors make referrals to specialists and that the referral forms were completed. So again, remember we're only here for one day, but we want to make sure persons know what to do when we're not here.
Well, what I know is that each time we go to a location, different people play different role regardless of what their profession is back in the mainland. You know, sometimes you work as a dental assistant, sometimes you work as a you know, whatever role is needed, you know?
Yes.
So that's how dynamic the organization is, and we all do what we have to do to get
yes,
things done, right?
Yes. And we look at each person's strengths too.
Right.
For example, you know, we have to do statistics. I'm also a statistician,
Right.
where we have to send data to the Ministry of Health. So sometimes after everybody goes back, I'm in my hotel room looking at collecting data.
Right. I saw last year when you're very involved with that last year.
Yes, and it's currently the same. Yes.
Okay. Well, thank you for all you do. And it's a nice, beautiful day. It was raining earlier,
Oh yes.
but it turned out nicely in the end.
Yes, it is. Thank you.
Thank you, too.
Sterilization.
God. Dr. Jacqueline Smith, how are things been going here at Grandspin Primary School?
Good. I feel like the patients are very appreciative and they're asking for us to come back next year. So we definitely need to come back at the same time.
Have you been seeing a mixture of students and parents, or just students alone?
Today, because I'm the gynecologist, we've been mostly seeing parents and teachers from the community. None of the students, but we'll see more students. More students towards the end of the week.
All right, well, thank you for coming, and we greatly appreciate it as usual, okay?
Awesome. Thanks, Garvin.
All right.
My name is Soupy.
Soupy.
Self-porridge and chicken soup.
Pablo, tell us about your jelly business now. What's jelly? Oh, yeah, tell us about this jelly thing here today.
Well, the jelly business is good, you know.
Yeah?
Yeah, very, very good. Can't complain at all.
You wanted to bring some jelly for the Jaja Foundation doctors?
Yes, definitely.
And nurses and the dental team?
Definitely.
All right, we appreciate you. Okay, Pablo?
Okay, thanks much.
Yeah, man. Big up yourself.
Yeah, man. See you.
Yeah.
Thank you, Jaja Foundation, for coming to our school today. Yay!
Jaja Foundation, Jamaicans abroad helping Jamaicans at home.